Welcome to the How to Die in Mexico podcast. We help expats live better in Mexico by addressing end-of-life worries and fears through education, contemplation, and planning resources. I am your host, Sarah Mae Conway, author of the book, How to Die in Mexico, and you can find me at dyinginmexico.com. Today I'm speaking with Deborah Bickel of Be Well San Miguel. Her organization provides patient advocacy services for English-speaking expats in San Miguel de Allende.
There's hugely divergent issues. What's going on with medical care here for Mexicans and what is available or coming on for for the expatriates. And few expatriates seem to quite understand. Well, they've never really thought about it critically. It's just a vacation. They thought about maybe the food, the views, how inexpensive life would be, etc.
Deborah is the person who can connect you to the best possible medical team, whether you need care at home or in a hospital. She provides translation services and helps people with emergency and end-of-life plans, in particular with the creation of advanced medical directives.
Mexicans don't often need euthanasia or don't often need hospice care. They go home and there are care providers at home.
We spoke about medical directives, but also about what's unique about healthcare in Mexico and what might make it most likely that your end-of-life wishes will be followed. You can learn more about Deborah at bewellsanmiguel.com.
The medical directives, that issue is really important, but the fact is the solution is pretty easy. Just, do it.
May this episode be of benefit to you, and if it is, I would greatly appreciate your support in the form of a like or follow, or better yet, leave a review. Yeah, how about we just start with, I'd just love to hear more about you and how you ended up in San Miguel de Allende.
It's kind of mysterious to me too. Um, I actually had been working quite some time based in Maputo, Mozambique, where I have a second family. The kids are my kids, my closest girlfriend and her husband. And I consulted from there. So I was all over Africa doing policy work for children, around children who are impacted by HIV. From Ethiopia to Ghana to Tanzania and Uganda. And then also looking at intersection of other natural disasters in HIV. I came to San Miguel really thinking, I'll just continue the work I'm doing in Africa. I'll just be commuting from Mexico, because I was also doing some work in Latin America. But it seemed to make sense to do something here in this community rather than their interests. If I had my druthers, if I had enough money, I would be doing very different work. A particular concern here in San Miguel is the health status of the refugees coming out from southern Latin America, and there's really good community program to help their needs. That's where I'd be. But at any rate, I have a clinical degree, and I did a graduate degree in international health, and then basically came here partly because my partner at the time was retiring and I wasn't. And so, but I thought as I got to know people, particularly the medical people in town, like, you have no idea how a bilingual person with clinical knowledge could help. You could build a business in a flash. Well, I built a business, but it wasn't in a flash. But there's very good luck in meeting Dr. Emilio Ramirez, pretty early on and he's my other partner in the practice. And then somewhat more recently, I've added a legal partner, a lawyer, Laura Menendez. But Amelia, when I first started the advocacy, I was just preventing catastrophe. At any rate, when Amelia showed up, it was with an injection of a lot of cash, small hospital, and they invited me to build Be Well with this hospital. And we had about 2 years, 3 years. It was really sailing, and then the administration, the donors, the funders crashed, so the hospital closed. And
Mm.
Emilio and I, at any rate, we've landed where we, for a while, what this practice was about was I knew exactly who was good. I knew exactly which hospital was top notch because Emilio was in charge of it. But the company, this is a second round of yet another investor, just decided Emilio was spending too much money upgrading surgical equipment and getting the MRI back up, etc., and basically fired him. So now our role is back to what it was in the beginning, preventing disasters.
Yeah, let me ask you about that because yeah, we're obviously talking about private healthcare
Yeah, this
here.
is
And I
private.
don't know if like maybe this is like something that people from the United States like even don't really understand like the tiers of the medical healthcare system, but like yeah, just like to go back to go back a step, it's like we're talking about private healthcare, and I hear you saying words like, the investors and they have expectations and, there has to be like a certain amount of profit or so to speak, or there's all these different interests like the investor's interest versus the doctor's interest versus the patient interest and maybe sometimes those things don't always, vibe together the way that we would want them to. Do you I mean, yeah, do you wanna, like, say anything more about that? And or I'm curious, like, h what's the public sector healthcare like
Well,
in
that's a
San
really good
Miguel de
question.
Allende?
I cannot get I have very little contact with the public sector.
Mhm.
They're very, with reason, they're very reluctant to have anybody but their own physicians uh,
Mm,
present in the hospital. Um, and it's a very closed ship, and there's some resentment between the physicians associated with public sector and those with private. And Emilio, bless his heart, has committed himself since he graduated to serve in the public sector if he was going to do private. So he's the chief of medicine at night of
mhm,
critical care medicine of the EAMS in Celaya. And we see some Mexican clients, and it's just a whole different thing. It's a whole
mhm.
different thing. I mean, it speaks somewhat of the chaos of Mexico. I mean, there's hugely divergent issues. What's going on with medical care here for Mexicans and what is available or coming on or available and come for the expatriates. And few expatriates seem to quite understand. Um, well, they've never really thought about it critically.
Mhm.
It's just a vacation. They thought about maybe the food, the views, um, how inexpensive life would be, etc. Until
Yeah.
it's like,
Yeah, yeah, and then they get sick, and then it's like, "Uh-oh," and then maybe like, what do you see as, like, the primary conflicts, like, the typical expat has certain expectations around healthcare that aren't being met, or is it just that they don't even know where to begin?
don't know where to begin.
Yeah.
I in I would say, but in large part, the people I refer to, the physicians I vetted, are very happy.
Mhm,
These They feel they're getting better care here than they were in the States, which is true. They're but it's but if they were to have a catastrophic event, they'd be better off in the States.
mhm,
You cannot you've gotta make a decision at some point, how risk averse you are. And I have a growing number of just conference calls with families trying to decide whether to move down here or to send their elderly parents
Mm.
down. So I would say people are, they just haven't, I find human beings in general that have very little curiosity about how the human body works and what happens when we live and we die. And it's maybe it's partly self-defense mechanism. I don't know.
Yeah. Yeah. I think you're probably right on it with self-defense, with, yeah, fear. um, yeah. Yeah. Uh, it's interesting when how you mentioned like how risk averse you are, or, I mean, I guess, yeah, it's like these are the questions. I want to talk about advanced directives today, but it's like these are really the questions that people should be asking themselves before they even move to
Right.
Mexico. Is like, yeah, like go way back, and it's like, yeah, I mean, in a way, it's like, how do I want to die? Like, if I fall,
And how
if
do I
I,
want to live
yeah,
how do I want to live and how long versus
yes,
how I want to die?
yes,
I think at Grandes, I mean, he was spot on, but that book is already 10 years old.
hmm,
But it was such a good uh, look at or ask the key questions. How do you want to live? How do you want to die? And quality of the later part of life.
yeah, yeah, and I find like a lot of people move to Mexico, in my experience, because specifically because they want to live with more intention. They want to live in a certain way, and it's interesting to me where that like living with intention kind of falls off. It's like as we age and get closer to death, yeah, like where the intention falls off and then denial starts creeping in.
Actually, that's an interesting question. But the medical directives, that issue is really important. But the fact is, the solution is pretty easy. Just, do it. It's not
Mhm.
as if there's any, you know I mean, not so much for younger people, because it would only come into play with trauma, be pretty rare. But for anybody, who has medical problems, ongoing medical problems, they really need to figure out, how to avoid being in a situation where they're kept alive against their will,
Yeah,
which will happen if they have money and
yeah,
they don't have an advanced directive. But if they don't have money, often the private hospitals will just discharge them. Most of my members will do them, but that's not why they contacted me.
yeah.
Usually people have done their homework. The people that actually contact me and are really good clients and end up running with me for quite some time often start in advance. They
Mhm,
contact me from the States, and I can give them a lot of information about, their decision making. Really, should they come to the United States or
mhm,
not, given their health concerns? And
mhm.
it's a hard conversation and a necessary one. And then as part of that, I always make clear, you need to do an advanced directive. It should be on your list of your first things to do.
Yeah,
It's unfortunate that it's not as easy as it is in the States. The States, it's you could just write it on a piece of paper, have the person who you're giving, the rights to sign it, and it's a legal document.
oh, interesting, yeah.
Not state by state, though.
Yeah, and yeah, and so here in Mexico, well, there's kind of 2 things going on, right? Like, I mean, some states, I don't know if San Miguel de Allende has this official, like, the voluntad anticipada.
It does. We were one of the first, but
Oh, okay.
yeah, and the lawyer, not Laura Miranda, but another one, Ana Andrade, was one of the people that crafted the bill or the policy. So she knows a lot about it, and she does it for our members. It's an added price point, but it really, I have the cost up if you ever want it, but it's not that difficult to do, and it's a necessary. But it's weird for most people to have to discuss such deeply personal issues with a notary public and a lawyer and a translator. You know, it's an odd. I could see why people have an aversion to doing it.
Yeah.
And if you don't have a lot of money, there's kind of no way to do it. What reason to do it? Because frankly, if you're at a hospital and you have a serious, say it was serious trauma, they will not, unless they know they can get reimbursed, that there's a rich family member or rich somebody, they will discharge.
In a private hospital, but maybe there's value. Is there value if I'm, an EAMS, going to an EAMS
Oh, no,
hospital, a public hospital?
Eames does it for you.
Yeah.
You have to go outside they have, my understanding, and I'm pretty sure this is correct, is it's part of, they have a process within Eames and within the general of doing advanced directives whenever, a patient is quite ill. They
Mm,
call the family in, etc. It's not always, they don't get it all the time, but it's less of a problem. What has been really ugly and nasty is, seeing people being held in hospitals and then basically harvesting. Like I had one example is this is a guy who recently arrived in Mexico. He's a friend of a friend. It's the only way I got involved. Had very bad head trauma. His widow was with him, or his wife was with him. They got taken to a really shoddy clinic in Chapala, and they basically, the guy had massive head trauma, and
mhm,
his wife knew very well he didn't want to be alive, and they put him on life support and called a neurosurgeon. Neurosurgeon didn't come for 5 hours, and when he came, he did a he did brain surgery. It made no sense whatsoever. None, none. Whatever was gonna happen, it happened. And then they wouldn't I got involved right after the brain surgery. They're like, "What else are they gonna do?" And it was on a Friday, and doctor said to me, "We had an abnormality on his EKG. We think he needs a full cardiac workup." It that anybody could do that straight faced, you know?
mhm,
So we ended up, connections through Emilio, and Lara finding a legal team that came in and got basically what they did. A lot of people don't know this, is if your wife or husband is here and is with you, almost always they will be able to take the decisions for you, even without that document. But only close family members, a daughter, son, wife, husband,
mhm.
only close, yeah. And they will take without checking marital certificates or anything. So that is the escape clause for those that haven't done an advance directive.
So, like, in this case, though, this gentleman who was having all this treatment done, was
Well,
his
he's
wife
dead.
not speaking up, or did she not realize, like, she
She did.
could.
She thought she called my niece, well, it was actually my goddaughter, who called me, and they didn't want him to go there to begin with.
Mhm,
But it was an emergency response, and unfortunately, the emergency responders had a contract with this shady clinic.
mhm,
So she couldn't intervene. She tried to intervene for the craniotomy, and she was in contact with me right after that happened. She realized how nefarious the whole thing was, but
mhm.
they couldn't get him out. They were using excuses like, "Oh, his oxygen's dropping a little low. We don't think he could survive transport to the hospice. He's going to the hospice to die." You know,
Uh,
it was the most, and it's not that long ago that this happened, and it could happen again right now. Whereas another example of how necessary it is, I had a woman who lives here alone, and she was facing a fairly serious surgery, and Emilio was going to be the critical care person, for the surgery, and I got close to her, and I knew what her wishes were, but she didn't finish her advanced directive. She started and didn't finish, and so she basically didn't come around after surgery. And Emilio said, "Well, if she had an advanced directive, we could get her out of here, but we don't. And the hospital is wanting to continue to charge a credit card. And he was in an awful position. And she finally died, but she didn't die for 7 days. So you can imagine that all the money was gone.
Yeah, in that case, no advance directive and presumably no next of kin that was right there that could say, "No, we're done with
Yeah,
this." Oh, yeah?
she didn't have somebody who was a spouse or a family member.
Yeah, yeah.
I had 2 years ago, somebody had burns and he was taken to the general. He didn't have a lot of money. He was 80 years old and something exploded and he had burns over 80% of his body. And I had his advance directive. And that was at the general and the young docs wouldn't honor it.
Mhm.
And unfortunately it was the weekend.
Yeah.
And that was not out of any other feeling but the ethics. They were taught, you do not let anybody die. And they were gonna send him to the burn unit in Leon. So
Yeah, you know, I've heard other people say a big part of this is the perhaps religiosity of most of the medical staff, like that being a primarily Catholic country, or yeah, that there is a feeling of like no matter what, we don't let people die. Like this is
that
not
it
what
is much
we
stronger
do.
here than in other places I've worked. You can imagine that in Africa, people had kind of given up.
Mm,
Everyone was struggling to live, and there weren't enough resources to keep people alive. It was just
mhm,
an obvious decision. You treat the people who are not infected or in later stages of AIDS. It was triage all the time.
mhm. Yeah. Yeah, yeah, I mean, and who's to say, like, Catholicism, but it seeps into the culture, right? And that maybe there is, like, a cultural, like, yeah, we're not
It's
gonna
very complex, though. It's very complex
Yeah.
because in many ways, the Mexicans are more comfortable with death and talking about death.
Mhm,
Yet they
mhm,
often, I've had situations where someone's diagnosed with cancer and the family's keeping it a secret from them.
mhm,
It's so it's all over the place. But I also some of the best. I was I have a lot of involvement in euthanasia law that was passed in California.
Yeah, I wanna ask more about, like, do you ever see a future in Mexico where there's something like death with dignity?
Yeah,
Um,
actually, I
yeah.
think it's just not going as fast as we would like, particularly legally, but I would say that the hospice workers, I have a hospice team. I don't that often have terminal cancer patients. They go home. I go to the States, but I had a death a year ago. The palliative care doctor was so wonderful, and what she said, so this is the line. So this, if you know someone's dying, they've been declared terminal. She said, I can help you out right now. I can give you an injection and you will die,
Mm,
or I can help you get more comfortable to see if you want to more days.
mm,
And that decision was put to the woman and to her husband. And it was a very she went to the emergency room. Emilio did his magic tricks to make it tolerable for her to have a few more days because she hadn't finished some personal work.
mhm.
It was just one of the most humane deaths that I've witnessed, and I've been present in a hell of a lot of deaths. So I see I think the law is gonna get, probably more liberal, and
Right.
there's gonna be for but, we got a problem here in that Mexicans don't often need euthanasia or don't often need hospice care. They go home, and
Mhm,
there are care providers at home. It they a hospice has been trying to open here and did again, but it's traditionally only served the expats and very little going to the Mexican, uh,
mhm,
population. It's just not what they just wouldn't think of it.
mhm. Yeah. Yeah, I've heard this too, and obviously, yeah, culturally going home, and yet, I think there's an issue with what type of access to comfort care or pain medications do we have when we go
And there
home, if
the
we
access
go
is bad.
home.
Yeah, it's really that is a huge problem, and it's for some reason, it's gotten worse in the last couple of years. We
Mhm.
used to have very easy access to morphine, fentanyl, but
Yeah.
well, for the obvious reasons, it's harder.
Yeah.
But if someone has a cancer diagnosis or a very real chronic pain condition, no, you we can care for it. I have a pain specialist and yeah, you can get it. But they're not
Yeah.
the greatest at pain control here.
Yeah. Yeah.
Mm.
Yeah, it's kind of interesting because it's like on the one hand, you have this example of the doctor that is just like, no, I refuse to follow the advanced directive, right? We're gonna keep this person alive. And yet, like on the other hand, it's like, something like euthanasia, technically illegal everywhere in Mexico, and yet is we can say the semantics of is it euthanasia or not, but it's sort of happening, on a case by case basis. And it's like this all sort of speaks to, I think in the United States, like there things are a lot more black and white. Things are legal or not legal, and they can happen or they can't happen, maybe. And it seems like in Mexico, there's more fluidity.
There's far more shades of gray.
Yes, yes,
Yeah.
and so in that sense, there's pros and cons to the
Mhm.
private healthcare system in Mexico, right?
Yeah, yeah. I really, though, cannot see a day where the majority of Mexicans will have good healthcare access to good healthcare. I just can't see Mexico ever making doing the hard work it would take.
And and say more about that and more about how how you're defining good healthcare.
Um, having available all the drugs that are on the WHO essential medications
Mhm,
list and ensuring that every person can afford their health care, that there is health care even for the completely disenfranchised.
mhm. Yeah, and maybe I mean, I don't know. I'm not a big I don't know a lot about Mexican politics, but there seems to be a conflict of, uh yeah, who wants to be a capitalist and who wants to be really providing social services for everybody that needs access to social services.
Mhm.
Um yeah.
Yeah, the progressive parties have not had as I mean, we're great. It's good that we are where we are, but, the Moreno Party, yeah, it's just Mexican politics are way complicated.
Yeah.
But I can't predict what's gonna happen, particularly because of the changes in the United States.
Yeah. Yeah, absolutely. Yeah. I mean, I think this fluidity, so to speak, the gray areas, I mean, to me, it feels like one of the main conflicts or not, yeah, challenges, I guess, as an expat is like, because it's hard just to have a piece of paper or say, well, this is the law or this is what the piece of paper says. And so I should have X, Y, or Z. It's like you really do need an actual living, breathing human advocate
Yeah.
who is
Yeah.
like with you, speaking for you, fighting on your behalf. And is it your experience that like this is where probably expats struggle because we don't have these like families or community networks here in Mexico.
Yeah, they need, someone like me. They need
Mhm,
someone like I mean, they need somebody who's bilingual, has a medical background, and understands the context here and the context is and mo increasingly helping them make decisions about going north for some events and staying here for other
mhm.
events. But, uh I don't know what's going to happen because demographically, there are a lot more people heading south
Mhm.
from the United States, and Mexico's not as friendly as they used to be. And they really do not want to have a lot of needy elderly
Mhm.
they have to take care of.
Yeah.
And
Yeah,
that's
yeah.
where immigration laws are going.
Yeah, oh, yeah, I can imagine, and even, now, like, the financial requirements keep going up and up, and I do see, like, the practicality of that, of not not having elderly that cannot actually afford to be here and get the care that they need, and they don't have family, and they don't have, um yeah, a good understanding of the Spanish language and ability to get help from their neighbors and
No.
so on, and yeah, there's a lot of gringos already here who are, yeah, getting to that age where they are gonna need help, and
Yeah, we should have this conversation a year down the line and just see how much it escalated. But I actually am going through a slow season for the Be Well, and there's more need for it than ever. So I don't know what there seems to be people don't understand the risks they're taking, and they're bargaining with their own lives.
mhm. By not planning, by not do you find that people, come to you once they've had that first emergency where, like
50-50.
yeah, yeah.
Yes. There's now more planners. Those are the ones I'm speaking to in advance.
Mhm,
But, but then, I used to a lot of my, I had all of a sudden, I'd be frantically busy because I had 2 home care 24-hour home care patients I was managing.
mm,
That's hardly happening at all.
mm,
Mexicans have stepped into the breach, and they can provide good service at home for a lower cost point.
mhm,
I mean, I use Mexicans on my staff, but there's an added fee because they've got me and Emilio and
yeah,
Laura. Yeah.
yeah.
So it's yeah, vamos a ver.
Yeah, I think I said before, like, to have somebody with your knowledge of, like, the local healthcare scene and who the good doctors are, who the best hospitals are, like, uh
And the fact that it changes by the month.
yes, yes, I would pay literally any amount of money for that because, you know, here, in my own community, I'm 2 hours away from the closest hospital, and if I really wanna have quote unquote good care, I'm gonna keep driving and go 5 hours all the way to La Paz, which is like the closest, biggest
Whoa, you're pretty
city.
isolated.
Yeah, yeah. So and then but then here in La Paz, it's like, what am I doing? I'm like getting on Facebook and asking in expat groups, like, who has a good doctor for this? Who has a good doctor for that? This is what people do,
Yeah,
right?
there's
And
all
they're
the
just
Facebook groups
yeah,
and
or looking at Google reviews, and it's so hard, but even private doctors, they're not online, like, they don't have
oh,
a
yeah.
web presence, it's so hard to find reviews, and so, yeah, I would pay any amount of money for somebody to tell me, "Here's where you go, here's the hospital, here's the doctor for exactly the thing that you need."
Yeah,
Um,
and I do that, and I can do that. It's just
yeah,
yeah, go figure.
yeah.
Um, eh, yeah,
Ye well, hopefully, yeah, after this, more people will be aware of your services and
that would
come
be a nice thing.
knocking.
Yeah, 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 yeah. Well, I'm always on social media. I mean, I do advertise, but at some point, I hate it all. So it's very difficult to make myself do it. So
Yeah,
it's
yeah. Well, yeah, I mean, we get into these things because we wanna help, right? And, yeah, we have to find a way to make money helping, but we're not marketers,
yeah,
not
exactly.
salespeople.
Yeah.
Well, it's interesting, like, you've spent all this so much of your career going around the world and helping all these different communities and yeah, especially migrant communities and maybe migrant communities to the US, it sounds like. Um, and so then I find it fascinating that here you are, somewhat of a migrant yourself, helping your own migrant community
It
in
is ironic.
Mexico, you know?
Yeah. Yeah.
Um, yeah, I mean, I read it in your email, but I don't know if, yeah, you wanna if you feel that connection there, if you wanna say more about that.
Which part of
Just
the
like
be
like
myself
to
and
go
with this
from yeah, your background of helping migrants who are arriving in the United States and then going from that and now helping,
I
expats in
actually
Mexico.
sincerely didn't quite make the connection. I am so aware of the privilege I have. I have no money, but my friends and colleagues and people I've lived and worked with in my family are my social capital, that is worth everything to me. And what a refugee doesn't have is that social capital. And that
Mhm,
I think is one of the most profound impacts of profound poverty is when you've lost your moorings in the way
mhm,
that exiles and refugees have.
mhm,
And it just breaks my heart. And I my mother was Australian and she was part Aboriginal. And she had a really difficult childhood and always wanted to be elsewhere, always wanted to be always was a wanderer and wanted to be. So she really encouraged what I did with my life, but I always thought of her as an orphan, and, and then my work started being with orphans, so there was some I was playing out my mom's karma there too.
mhm. Yeah. Yeah, I mean, it I find it fascinating, this connection between what you're saying is, like, the loss of your social capital as being this greatest poverty, and here we are talking about, you know, being expats from the US and Mexico, we do have a lot of privilege and, like, relative, financial, safe safety, I don't know what the word
Okay. Right, yeah.
financial security, um, and yet so much of the struggle of the expat here getting good care or care towards the end of life is because they're disconnected from the community.
Yeah, yeah,
Um, it yeah, and all the money or the piece of paper with the advance directive is not what's gonna help you,
it's a
it's
good point.
did you try to learn Spanish ever? Did you
That
ever make friends with your neighbors? Did you ever what were you doing all this time that you lived here to really build up, like you're saying, that social
mhm,
network?
mhm. Yeah, and many people do. There
Mhm,
are people who had a second life here,
mhm,
open NGOs. I think we have the highest number of NGOs in any single, municipalidad,
mm,
ACs and NGOs, but that's good food for thought of, um, how did I create a situation where I am a refugee or in exile? But when it's self-imposed, it's
yeah.
not as painful.
Yes, yes.
Yeah,
Certainly, yeah, a whole different thing, but it is, yeah, fascinating to me, yeah, like how we, yeah, where's gonna be the connection to care at the end of your life, and is it, you know, what happens when you can't, like obviously how much money you have matters, makes a difference, but, it's not everything here in Mexico,
well,
it is
right.
yeah,
Yeah.
and, like, you're even pointing out instances where it's like, because you're seen as someone with money, that could be harmful. Like that could keep you in the hospital, or that could prevent someone from honoring your advance directive. Yeah. And so, like, if I'm a cynical expat, like, what is even the point of me writing an advance directive?
If you're not married or partnered, and you don't have somebody who's like your best friend who's in the medical field, you could very easily end up in a situation like this client of mine was not very old, actually maybe somewhere between 40 and 50, who died, basically didn't come back from surgery. I mean, it would have, who knows what we experience after death, but we do know it was not a good death. She had to die in the ICU and with a, yeah. But that is somewhat unusual. People, yeah, that there are things that made it unusual. But I have no blanket um, opinions about all the gringos because every situation's so different.
It's case by case, and there might be, a situation in which I really have to fight for my advance directive to be honored, but it's
You pretty,
definitely better to have
yeah,
one.
it's definitely better to have them. It's not cheap. I've got the price. I think it's probably this price in any state at this point. No, ours is cheaper. Um, but let me see, where is it? If someone names me as a medical representative or Amelia, 5,000 pesos for the lawyer and the translator and the notary. Then 3,000 pesos if I'm the medical representative, and then 2,000 to 2,000 for the lawyer to sit with them. Are
Mhm,
is really doing the end of life decision making. So it's
mhm.
it's not nothing.
Yeah, yeah. And
I haven't done it, and the reason I haven't done it is I'm intimate friends with the medical community. I know
mm,
exactly what, Amelia knows what I would want.
yeah, yeah. Yeah, and I think that that's, like, valuable, worthy to point out of, like, again, a case where it's in-person human relationships that are going to trump whatever you might have on a piece of
Yeah,
paper, you know?
yeah, yeah,
Um, and so if I do want an advance directive and say I happen to be bonking at the price,
yeah.
why couldn't I just have my advance directive from the US, or just have my advance directive
It's
from
not
the
honored.
US
It's like
translated into
nothing.
Spanish? Yeah.
It means nothing. Means nothing.
Yeah.
I would, if probably if I were you, I would just put my energy into cultivating a good relationship with a physician.
Mhm. Yeah.
But you're far away also from a hospital.
Yeah.
Yeah.
Yeah. But there's so much, value, yeah, for all expats to have that relationship with the physician. It really sounds
That's
like
more of what I really push. Every member has, I take their medical history in English, and then Emilio sees them, and he only charges like 1,000 pesos, and he does a
mhm.
history in Mexico.
Yeah, I've heard, yeah, obviously there's great value in having a doctor that knows you and knows your desires and will maybe advocate on your behalf. And also at end of life, it's my understanding that having that relationship with a doctor could maybe help prevent the need for an autopsy,
Yeah,
um, as an expat,
yeah.
and that's really valuable to a lot of people.
It is, it is. And,
Mhm,
um, you could see it. I think this just comes down to how much money someone has, how close they are to the community here,
mhm,
if they're in a coupled relationship.
mhm,
Um, all these variables. Um, but there are people who really do need it, like the couple, the guy started being Parkinsonian, and he's now had several falls, and
mhm.
she's not always with him, and we need directions as to what to do.
Yeah. Yeah, and you mentioned, say for people who aren't in couples, like you mentioned that people will sometimes name you or
Emilio, ayúdame.
Emilio, yeah, as their decision makers.
Mhm.
Uh, is that something that happens often? Like,
No, really, you wouldn't do it because it's again, you could assume if someone didn't trust me or Emilio, why would you put your life in a
mhm,
physician's hands who just the other day had to keep a woman on life support who he knew didn't want to because she didn't have an advance directive.
mhm,
So, I mean, the thing is that Emilio is such a rock solid person and establishes very good relationships with his patients
mhm,
that, s he would never, um, not do the right thing.
yeah. Yeah. Yeah, and I imagine if you have a relationship with a doctor, this is something that you kind of learn over time too. Like
Yeah, they may
you
have
get
values that would work against it. It may be that they want you to have
yeah.
an directive, or it's and also, if you're trying to find when you're looking for someone who's willing to do euthanasia,
Mhm,
it's it can be hard
mhm.
because they're definitely risking their license.
Yeah. Yeah.
On that happy note.
Well, on that happy note, it's like I feel like the picture that's forming is like really the most valuable. If I want to have this quote unquote good death at the end of life as an expat, yes to all the legal paperwork, but really the most valuable thing I can do is to work on relationships, to
Mhm.
work on a relationship with a doctor, probably first and foremost, and or other certain community members that might advocate on my behalf, to make sure my closest partner knows exactly what I want because maybe that's not always the case.
Yeah, and you think they know and they don't. The other is to, if you live alone, is to have somebody who has a key to your house,
Mm,
and someone checking in. I have a fair number of women living alone, and they coulda died, if a landlady or a friend didn't stop in on that
mhm.
particular day.
Yeah, you mentioned, falls as probably being, like, the number one.
Yeah, it's the number one thing that raises all these issues.
Yeah, yeah, yeah. Yeah. Yeah, I hope for you that all these people that are pre-planning in the United States and calling you before they even, make the move, that's, like, a
Yeah.
really positive sign, and that it means that people will be moving to Mexico, perhaps with, like, more intention around, uh, how am I gonna have care? How am I gonna have care as I age and towards the end of life? And yeah,
Yep,
yeah,
putting the word out there.
yep. Well, thanks, Deborah.
Yeah, good to get to know you, and take care.
Okay, you too. Have a wonderful day. Thanks for your time. Bye.